Hi, everyone. My name is Jackie Medcalf, and I'm the founder and executive director of Texas Health and Environment Alliance. For years, communities in East Harris County have been asking a simple question: what's happening with cancer where we live? Now, for the first time, we have detailed census level data across Harris County that's starting to answer that question. So, the backstory: this didn't happen overnight. The information you see on the screen and the maps and data I'll share with you in the next few minutes followed years of advocacy from area residents and community leaders pushing for cancer studies in this area, starting around concerns with the San Jacinto River Waste Pits Superfund site. So back in 2015, Texas Department of State Health Services conducted the first cancer assessment for our communities. And then again in 2025, they produced an updated study. Both of the studies showed elevated cancer rates across a 257 square mile area. However, the second study only gave data for the entire study area, which left many of us wondering, what's happening in my specific neighborhood? We sent hundreds of letters to Department of State Health Services requesting that they provide our communities with census level or neighborhood by neighborhood level information. However, they continue to this day to decline that request. So what I have to show you today is how Harris County stepped in and filled this space for us. They did something really important. So they were able to get the data per census tract and they analyzed it, but not only for our East Harris County cancer study area, but for the entire county. This is the most comprehensive data set I have ever seen publicly available for public use. So let me walk you through it. So on this landing page, the Harris County Health Department put together an intro with a very brief overview of what they did. And then up here at the top, you'll see you have the option to click on Harris County Reference Map. You'll have the option to click on Texas Reference Map, and then the methods behind the study. We'll get to those a little bit later. So the Harris County Reference Map allows you to look at cancer rates per census tract compared to rates across Harris County. That's a very important catch. Why does it matter? Well, Harris County is known to have high disease prevalence. So essentially, if we're only comparing our census level data to Harris County data, we're going to water down our results. And I'll show you a little bit more explanation of that pretty soon. So over here on the left-hand side, you have the legend. So you can see here, if there's a census tract in red, it has cases of the particular type of cancer that are higher than expected. And then it goes down to the white, which is about what you would expect to see compared again to a community in Harris County. And then the dark gray is where data has been suppressed. We are still trying to figure out information about why data was suppressed, what were the decisions behind this information. And so although we have this incredible resource at our fingertips, we're still going to be working to get more answers. And then the lighter gray means that they simply did not have any data for that census tract. So let's walk through this a little more closely. Let's click on brain cancer, for example. So you can see here in Harris County, brain cancer is higher than it was expected in comparison to Harris County in several places. Not an incredible amount of red on the screen, but of course more than we would like. And I will note that this area over here is the East Harris County Cancer Assessment Area. This is that 257 square mile area that I was explaining earlier. And there are no elevated brain cancer census tracts in this area, which is a bit surprising because it did stand out in the state study. The next option I'll show you is up at the top with the Texas reference map. This is what we want to look at. We want our community's health to be compared to a comparable community in Texas, one that does not have the industrial corridor that our county and our region has here. So you can see right away, we're clicked on bladder cancer and it's giving the results from that. You have the option to go across each of these cancer types and see how the rates compare in the specific county. You also have the option to put in an address. Let's see, let's put in an address. Fantastic. Okay, so here we are. If you want to find a specific area of interest, or perhaps your home address, perhaps the school address for your children, you can do so. And you can click out of that box and it will leave this little circle so that even as you move across the map, you'll still be able to see how that area compares to other places. And then down here is the methods section. So in this section, they talk about how they did the study, the data sources for the study, the limitations, and the census tract list for the East Harris County study area. The information here throughout much of this study is very limited. For example, we do not have information on the standardized incident ratios. We do not have case counts, and there's a variety of information like that those of us that are a bit more technical really want to dig into. We want to better understand how they came up with these specific designations. This data gives us a much clearer picture of where cancer rates are higher than expected, but it doesn't tell us why. However, following the patterns and looking at the spatial distribution, as well as the different layers overlaying multiple cancers, can give us insight into what perhaps might be going on. Cancer is complex, right? And so there's many factors that play a role in why someone gets cancer. This map does show, though, that location can play a role in that. I'm going to give you a very clear example on location playing a role in that and the importance of methodology in studies like this. So let's look at the Texas reference map for brain cancer. You all ready? It's shocking, guys. Seriously, look at this. Almost all of Harris County is red. So much of the census tracts in Harris County are standing out here having higher than expected cases of brain cancer. Now, this is all brain cancers, and this is compared to a comparable community in the state of Texas. This is alarming. Everyone who lives in Harris County, everyone who represents Harris County, should be looking into this. What is going on, Harris County? If we were to look at these dark gray areas where data has been suppressed and understand if it was suppressed because it was also high, but there was a population difference that caused a need for the state or the county to suppress this information, I think this would be a much more daunting picture than it already is. But to go back to that methodology point, look at how striking this is. And now let's look at the same cancer type, but comparing it to rates across Harris County. This tells a very different story. And this is a clear example of why methodology matters so much in studies like these, and why our role helping communities navigate these types of studies, from asking for a study, preparing to make that request, to then even understanding the findings and making sure that your community is not getting bamboozled by these tiny little nuances in methodology that most of us just simply don't know to look for. So this brain cancer example is, as I've said, the most striking. But there's also another missing component here. What about childhood cancer? We're not being told by this information what of these rates are being driven by childhood cancers or cancers of adults. And so we continue to have additional questions that we will inquire with the local health department as well as the state health department, and of course the experts that we consult with. But at the end of the day, this is a huge step forward. I encourage all of you to use this tool to investigate it on your own, as well as the published report that the county produced. And for all of us, that have rallied around trying to secure local data for years, this is a big step for us. This is a win for all of the years that we've stuck together and said our county or our communities in Harris County deserve census level data. We deserve to know what is going on with the health of our community. So now The next step is making sure that it leads to informed decisions and real accountability. We've got a lot to work with here, and I hope that you all will continue to stay engaged with us.